Did you know your overall health depends on a microscopic layer most people have never heard of? The glycocalyx? Welcome to the future of vascular health. Healthy Vessels, Healthy Future, the podcast dedicated to uncovering the hidden science behind vibrant health, longevity, and vitality. Brought to you by the Glycocalyx Research Institute, each episode delivers cutting-edge insights into microvascular health, empowering you to finally understand why you might be experiencing fatigue, brain fog, or poor circulation, even when your labs seem normal. Through actionable advice and expert interviews, you'll learn how protecting your glycocalyx can significantly improve circulation, support your heart, enhance brain function, and prevent serious vascular issues before they begin. Tune in weekly and discover how healthy vessels today create a healthier, brighter future tomorrow.
And this is just a slide that shows, as a function of increasing blood pressure on the horizontal axis. So again, it shows the high number and the low number, and it goes up from like ideal 150 over 75 to 135 over 85. So with every 20 millimeters of mercury increase of systolic pressure, or every 10 millimeters of mercury increase of your diastolic pressure, it shows that your risk of cardiovascular complications, or a heart attack or a stroke, doubles. Every increase in your blood pressure with 20 over 10. So you see, as soon as you hit that 175 over 105, for instance, you have 8 times higher risk of a stroke or a heart attack.
So may I interrupt you momentarily to ask, because I know patients see this, they go into their doc, they sit down and get their blood pressure taken, they'll get a, 130, 140 over 80 or 90, and their doctor says, oh, well, that may be pre-hypertensive, that's okay. That's not actually okay. There is a significant 2 times risk there. Cardiovascular events. So that patients need to be on top and watch those numbers.
Yeah, you should not be happy with those numbers.
Absolutely. Most doctors are, though.
So it's getting much higher, but go ahead, Bob.
I was going to say, that's why it's sometimes high blood pressure is called the silent killer, because you don't really feel anything. And it kind of sneaks up on people unless they monitor their blood pressure. And if they don't go to their doctor regularly, they don't actually know what their blood pressure is. And so I know people that tune into their blood pressure have blood pressure cuffs, and they monitor their blood pressure on a regular basis. And their blood pressure can be different in the morning, different in the middle of the day, and it can be different at the end of the day. Mm-hmm. And so it's important to understand, where is your blood pressure, because it is an important part of your health journey in predicting your risk and longevity.
Absolutely. Thank you, Bob. Yep.
Well, just in a similar line, a little bit more detailed. This is the same kind of graph. This is about cardiovascular disease risk. It's a function of blood pressure again. The left panel is that systolic blood pressure, the high number. The similar for the right panel is on that lower number, the diastolic blood pressure. Mm-hmm. It shows for different age groups. So the low line is for the young people of 40 to 49, going up in steps of 10 years to people of 80 to 90. But for each different age group, it's clear that when your systolic blood pressures increase, let's say from 110 or 115 up to 180, is a very strong increase in your risk of cardiovascular disease. So you see, if you go from the young people that normalize the risk to 1, if their blood pressure increases to 180, there's about an 8 to 10-fold increase in cardiovascular disease. While if you look at higher ages, let's say people of 60 years old, so this line in the middle, they're already at a normal blood pressure. They already have an 8 to 10-fold increased risk of cardiovascular disease. Makes sense, because they're not 30 anymore, they're 60 or 70. Mm-hmm. Same for each age group, that risk increases from like 10 to about a 30-fold. So there's about an increase from 10 times risk to a 30 times risk of a heart attack because of increase in blood pressure. And same for the diastolic blood pressure. So whatever age you are, increased blood pressure is a high risk of cardiovascular disease. And this is a very similar curve. This is, instead of risk of cardiovascular disease, this is risk of stroke. So again, with increasing blood pressures, the risk of a stroke increases about tenfold or more if you go from a diastolic pressure of 120 to a diastolic pressure of 180.
Amazing.
So that's why we don't really understand how that's all related, but these are just the statistics. On average, people with a high blood pressure will have a much higher risk of a stroke or a heart attack. So even more reason to try to understand what's causing it and what can we do about it.
Sure.
And that's a disappointing part. This is just an overview of the different causes of hypertension. And actually, what's most important, if you look at this pie, and it takes out the different pieces of known causes of hypertension. Now we can talk about these, and most of them are related to kidney issues. But the biggest part of the pie is this on the left. It's called essential or primary hypertension, which usually means we don't know what's causing it. So most people have essential hypertension, which is a nice way of saying we have no idea what the problem that causes your hypertension.
But we do, don't we?
Well, we have some ideas. So this is just showing a little overview what might cause that primary or essential hypertension. We will talk a little bit about the vascular stiffness. So those large arteries are supposed to be elastic, and that's helpful because when the blood is pumped into these elastic arteries, that just dilate a little bit, and that prevents blood pressure to go up too high. But with age, vessels become super stiff, and we'll show some data that if you repair your glycocalyx, you can actually make your vessels more elastic and prevent that stiffness. Another important part is what we call increased sympathetic activity. Actually, those are all kinds of hormones that will constrict your blood vessels, make them smaller, causing organ resistance to go up. And in a healthy individual, that's balanced by nitric oxide production that dilates your vessels and keeps the resistance low. But again, as I told you before, when your glycocalyx is compromised, there's less nitric oxide production, so that balance will be more towards the constriction. And then this word rarefaction, that nobody even knows what that means. Actually, what it means is you're not losing your microvasculature. You lose all your capillaries. So even before hypertension starts developing, at a very early stage of pre-hypertension, if you would take a picture of any organ and you count the number of small capillaries, those numbers will start decreasing by 30, 40, 50% with age, before blood pressure actually starts increasing. So it's important to check how many small capillaries you have. We know you will lose them as soon as glycocalyx is compromised, and we know we can reverse that with that Revasca therapeutic, and I'll share some of that a little bit in the next few slides. But before I do that,
Hans, if I could interrupt you just a second, I think what you've shared is super important. And so I think typically your audience might think of high blood pressure as a middle-aged person or an older person problem, condition, or disease, however you want to classify it.
Correct.
But what we're really seeing is a trend now where we see people in their 20s that have high blood pressure and are being treated for it. And so I think it goes back to all the lifestyle things and choices that people are making, the stresses that people are under every day, and their ability to control their stress levels and really understand the impact that has long term on their vascular system.
Yes. Absolutely. Absolutely. I think that's a great point, Bob. And thank you both for making that. And on this note, we've hit about 34 minutes. I want to take a brief break. I do have a wonderful sponsor that needs, has a brief commercial I'd like to run, and come back on the other side and talk more about this. You tied it up very, very well, though. And I think in the end that there is damage to that microvascular, bed, that capillaries that go into organs. And this starts early. This is where you you don't see a problem, you go to your doctor. You don't, they don't address those blood pressure changes early on, and things start to tumble early. And that's why we want to jump on this at an early age. So we will take a short break. For everybody listening, you again, go to the YouTube if you want to see these wonderful slides, drpbetterlife.com, or if you want to see the previous show too with more information on Glycocalyx, drpbetterlife.com. We're going to step away for just a second. Be right back.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Everybody, welcome back. I'm Dr. Maryanne Pinkston here with Robert or Bob Long and Dr. Hans Vink. We're talking about hypertension. Very interesting. A lot about the causes early on and how it affects us. I think we're moving into a little bit about, more about the glycocalyx and how we can actually treat and reverse this. So please know that there are options for you out there to take control of this early on or late, and get control of your blood pressure before it affects your kidneys, cardiovascular system, etc. So guys, welcome back. Continue. I apologize for the stop there. Please continue.
Well, thank you. Like you said, it's now time to start thinking about our options. What can we do to repair your glycocalyx? And do we have some data that supports the possibility that we can actually reverse hypertension or high blood pressure, bring it back to the normal range, and hopefully have better outcomes for many individuals. So I already mentioned before that we have the Revasca therapeutic. That's a third generation of glycocalyx repair therapeutic based on natural foods and seaweeds like fucoidan, hyaluronic acid, and aloe vera, and some other nitric oxide boosting ingredients and other ingredients that capture oxygen radicals that degrade glycocalyx. So before I show some of those studies that we did with Revasca in experimental settings, but also in patient studies, I'll give the word shortly back to Bob to talk about how people can actually get access to Revasca.
Yes.
Well, thanks, Hans. Just to reiterate again, for those people that are interested in trying Revasca, we have a special buy one, get one free offer, and they can simply go to our website, glycocalyx.com, and they go and place an order for 2 bottles and then put in the coupon code BOGO, BOGO, and you'll be able to get 2 bottles shipped to you for the price of 1, which will give you 2 months to try it and check and see how it affects your blood pressure.
Excellent. And for you guys who are on YouTube, you're seeing the code. For you that are not, we will have that on the website as well. So drpbetterlife.com, have the code and the websites and all this information. So please visit. Thank you, guys.
All right. So I want to start with some pilot data that Bob and I collected some time ago. This is just showing from left to right the increase in your microvascular health in people taking the Revasca supplement over the course of 3 to 4 months.
Wow.
So actually, the most important part is the yellow line and the blue line showing that your numbers of capillaries and your microvascular health score go up significantly by more than 50% shortly after taking the Revasca supplement. And also the other line, the orange line, is a level of glycocalyx damage going down. So with the supplement, you repair your glycocalyx and you have improved functionality of your microvasculature.
Nice.
So it's the first set of data. I want to show an animal study that we did on aging. So this is comparing young mice with old mice and see how that getting older affects, the number of capillaries you have, for instance, and what the impact is of Revasca. So just to explain, the young mice are the grayish dots, and then the blue squares are old mice not getting a glycocalyx supplement, just aging. Then we have the red triangles, again, are the young mice that were getting the supplement. And then the green diamonds are the old mice, same age as the blue squares, but getting the supplement for 8 weeks in their chow.
Wow.
So most important, if we start on the left, this is just to see the effect of aging. So on the vertical axis is the number of microvessels, and on the left to right is the size of the microvessels. And the ones you're really interested in are the smallest microvessels, the capillaries, where all the nutrients are being exchanged. So those are in the 5, 6, 7, 8 micron range diameters. If you look at the gray dots compared to the blue dots, you see there's a significant drop, more than a 50% drop in the number of capillaries just because of aging. So you lose a lot of, with age, you lose a lot of your capillaries, and that increases the organ resistance, and it will contribute to blood pressure, for instance. Well, on the right-hand side, in the middle, it compares the old mice taking the supplement, the Revasca supplement, in the green, compared to the old mice not taking any supplement. And you see, just taking the supplement for 8 weeks in these old mice completely normalizes their capillary density.
Are you feeling tired, foggy, or noticing poor circulation despite doing everything right? The answer might be hidden in your microvascular health. Introducing Revasca and Renew, 2 groundbreaking supplements scientifically designed to restore and protect your vascular foundation. Revasca revitalizes your circulation, supports heart health, and naturally boosts your energy by repairing your blood vessel lining, the glycocalyx. Renew complements this by providing deep cellular repair, resilience against stress, toxins, and inflammation, and enhancing your overall vitality. Together, Revasca and Renew offer the complete solution for lasting health from the inside out. Visit glycocalyx.com today to learn more about how these powerful supplements can help you reclaim vibrant health and lasting energy.
Wow.
And the same, if you compare on the right-hand side, it's back to normal. So, just taking the supplements will reverse that loss of your capillaries, and your microvascular health is as you were a young mouse again, at least in this study. As a consequence, we looked at what changes if you repair your glycocalyx. On the top right, it shows nitric oxide production. So nitric oxide is important to dilate your blood vessels, increase blood flow, and prevent hypertension. So with aging, going from gray to the blue bar, there's a significant drop in your nitric oxide production. On the right-hand side, the green bar shows if you repair your glycocalyx, your nitric oxide production is pretty much back to normal levels. So that is fixed by taking the supplement. Well, sure.
May I ask you a question? I apologize always. I'm a big interrupter, but I'm curious because I think the audience too might benefit from understanding that aging may be the lifestyle features too. So people have had, stress with their work and not
bring
taking
up a perfect point. Yes.
Yeah.
I've looked at aging per se. If you take away all the risk factors and lifestyle factors that come with aging, smoking or diabetes, or lack of glucose control, or lack of exercise. If you take all those risk factors out, and you look at an older individual that lives the same lifestyle as a younger individual, then the aging per se is not a very important determinant of microvascular damage and hypertension.
That is profound. But may I ask another question too? You may not have studied this, and I understand now we want to bring, kind of scientific evidence to bear on all this. But if you do not have good blood, capillary beds in your brain, your kidneys, we've talked a lot about the cardiovascular system, but there are other things that people, develop and suffer and die from, dementia, kidney failure, things like that. And so can we extrapolate that taking care and creating more nitric oxide or whatnot, improving those vascular beds in the brain, the kidney or whatnot, might also prevent some of those diseases as well?
That's a very good point. We are actually looking into all these other organs also.
Wonderful. Wonderful.
And I took a few slides out, but I'll show you, for instance, in a kidney patient, showing before and after a few months of taking the Revasca, how that impacts the microvascular health. But more importantly, we saw also reversal and improved organ function also for the kidney. We have
Wow.
seen people with very poor kidney function, with what they call a glomerular filtration rates, or how much urine you can produce. So it should be like in the 100 range, people going down to as low as 25 or 30, which is
Wow.
critically low at the point of kidney transplantation or dialysis. We've seen if people repair their microvasculature, we've seen improvements of kidney function back into 60, 70, 80 mils per minute, back into almost normal range. And similarly, we're also looking into brain function. So early cognition impairment, we think, is strongly related to breakdown of your microvasculature.
Absolutely.
And that's on our top of our list to see if we can also improve cognition by repairing microvasculature, not only in the rest of the body, but also in the brain. So yeah, perfectly right.
Thank you. You guys are saving a lot of lives. This is wonderful. Yes.
So I just want to move on a little bit in that aging study in mice. On the top right, I will focus. This is blood pressure, and it shows the gray are the young mice, even before and after taking the supplement. Then the blue, old mice not taking the supplement. You see blood pressure increases, as we know that happens with aging. And on the right-hand side, especially the green, are the old mice. So the solid green bar is the old mice at the start of the study before they start taking the supplement. The same mice, 8 weeks later, their blood pressure normalizes back to normal levels. So we can completely reverse that effect of aging. And an important part of why is blood pressure going up? We already showed that the supplement repairs that capillary density, you get more capillaries. Another important part is on the large vessel wall stiffness. And so what keeps those vessels elastic to start with? So there's a molecule in the wall that's called elastin. That's for elasticity in the large vessels. So with aging, you lose a lot of your elastin, which makes them less flexible. But if you take care of your glycocalyx, you also take care of that elastin. So older vessels keep being elastic as long as you take care of that glycocalyx. Same, another molecule in the wall that causes stiffness is collagen. So with aging, if you don't take a supplement, you see the level of collagen in the wall of those large vessels increases, but it can actually severely normalized or attenuated if you take the supplement. So the more elastin, less collagen with taking the supplement that takes care of the glycocalyx is also part of the normalization of the blood pressure. So more capillaries and blood vessels become less stiff when you do that.
Wonderful.
Well, I told you about the kidney study, so I put this slide in. This is a kidney patient on the left before taking the supplement. So this is measured with the Glycocheck system on the whole body level. You see only very few capillaries, a very poor microvascular blood flow. This is the same individual 3 or 4 months after starting taking the Revasca supplement to improve the health of your microvasculature. So you don't need a lot of high-skilled math to understand that on the right-hand side looks so much better than on the left. And the impact not only on kidney function, but also whole body organ resistance and blood pressure, for instance.
Amazing. 4 months, you say?
This is 4 months. So I'm going to show a couple more slides of similar studies in different patient groups. So this is the impact of the therapeutic for 3 or 4 months in patients with psoriasis. So psoriasis is a skin immune disorder, but it's also strongly coupled to cardiovascular disease.
Yes.
So what we've seen now on the left is our measure for glycocalyx damage, and the dark bars is the change in glycocalyx damage taking the supplement compared to people taking a placebo. And they all got their immune therapeutics. On top of that, they got the glycocalyx therapeutic. So there's a strong reduction in glycocalyx damage, so your glycocalyx gets more healthy. But more important for this talk on hypertension, the middle and the right-hand side shows measures for arterial stiffness, to the stiffness of your large arteries, either measured by pulse wave velocity or what we call the augmentation index. But it clearly shows if you take the supplement, the stiffness of your large vessels significantly reduces, way more than just immune therapeutics. So this shows for the first time that also large artery stiffness is improved taking the supplement. And as a result, if you look at blood pressure, this is just a study that's ongoing in people with high blood pressure that do not respond to conventional therapeutics. These are on the left. No, these are patients with a systolic blood pressure, the high number, somewhere between 160, 170 millimeters mercury. This is after a few months of taking the supplement, back to the normal 120, 125 range. And the same for that low number, the diastolic blood pressure, also was high. It was like more than 100, going back into the 80-ish range, which is the normal range. Just taking this is just proof of concept. So this is not a full-blown clinical study yet, but it shows the potential that people with high blood pressures can actually normalize and have the positive functional consequence of that. And to finish, I just want to show one other example. This is an individual that had an open skin wound in the lower limb. And on the left-hand side, you see there's an open wound that didn't repair. The skin is very dark, and the lower limb was at very high risk of amputation. At the same time, this individual also had a very high blood pressure. So blood pressure was 200 over 110, which is way out of the normal range. And also for many years, so didn't respond to the conventional antihypertensive medication.
So at that time, she was on 3 hypertensive meds, and it still was uncontrolled.
Wow.
So, I believe. As soon as she started taking the Revasca, so this was in, let's see, when was it? So it was end of April 28th. So this is 2 weeks later. You already see that within the wound area, now blood starts to improve. So instead of very pale, now you see the microvasculature being repaired. 3 months later, the skin color completely changed, and the wound is closing. And then, in October, the wound almost completely healed. But even more important, if you go from end of April and look at the blood pressure, it drops. Like acutely, almost from 200 to normal ranges, and stayed in the normal range. So if we have to caution about side effects, we've seen this multiple times. Some people with super high blood pressures, their blood pressure normalizes so fast that actually they get dizzy when they get up because they're not used to normal levels of blood pressure anymore.
That's correct.
They have to actually dose down a little bit to prevent the dizziness side effect, which actually is a good thing. But you be careful that you don't change.
Or their doctor didn't decrease their medication as their vasculature were improving. They're still in those high doses, and it's time.
You're absolutely right. So
closely decrease the medication.
Perfect.
Oh, that's what I was going to emphasize. So the people that do go on Revasca that have high blood pressure, they need to watch that, and they need to work closely with their personal physician, because there's a high likelihood they'll reduce or maybe even eliminate the hypertension drugs that they're on, because what we're doing is we're treating the root cause inside the body of what caused high blood pressure in the first place. So most high blood pressure drugs are really tricking the body, trying to get it to do something to counteract what's actually causing the breakdown. They're not treating the root cause, which is what Hans talked about so eloquently in our presentation. And so the key takeaway is blood flow, and blood flow is essential to life. And that blood flow happens in the smallest of small vessels called capillaries. As we age, we lose those capillaries. And how do we know that? It's because we have the Glycocheck device. Your doctor doesn't have the luxury of having one of those. Until about 2 years ago, they were only used in academic research hospitals and research labs around the world. But now we're introducing the Glycocheck to medical clinics here in the U.S. And you can get tested. If you go to our website, glycocheck.com, or you can get there through glycocalyx.com. There's a locator where you could go be tested. But the bottom line is simply taking Revasca, whether you get tested or not, you'll see through the traditional measurements that you have with your doctor an improvement in the measurements that he's tracking, specifically your blood pressure.
Correct.
Well, with that, Bob.
And which
So
is
it's
great.
wonderful.
And you guys are offering, and you're about to highlight that, Bob, with the code that you're offering. And we are not trying to push supplements on people and get people just to buy. We really want you to understand getting to the root cause is very important. Also adding in, you have to eat well, exercise, reduce your stress, stop smoking, things like that, reduce your risk factors. But you guys are offering kind of that buy one, get one free. That's a 2-month supply for the price of one. That gives people, if you highlight the slide before, that gives you a very quick reference of how quickly things can change. Might not, completely heal or completely change things. It takes some time to do that. But within that 2 months, you can see some changes and improvements. And that's time enough to help convince you to understand what's going on is underneath is very important. And what you do makes a difference.
Exactly. And so I guess in conclusion, the thing I just want to stress to your audience that I'm sure they didn't know before today's call, and that was the term glycocalyx, what it is and what it is in your body. And what we've discovered over the last 15 years with all of our research that we've published is, number one, if I ask people what's the largest organ, typically they're going to tell me the skin. Right. It turns out actually the glycocalyx is the largest organ because it's systemic through your whole body. Your vascular system where blood flows is over 60,000 miles in length, if you can understand that. And that square footage of all of the blood flow area, we estimate to be about 7,000 square feet in that little body of yours. And so blood flow is absolutely essential. And that's the thing that breaks down as we age and as we're exposed to all the risks. And what breaks down are those capillaries and your body's ability to deliver that blood to all of the essential cells, organs, muscle, and tissue. And so I think you have a link to our website and also to our YouTube channel, which is the Glycocalyx Research Institute, which your audience can go and learn more about. So we're happy to be here, and we look forward to potentially being with you in the future to talk about some other conditions and diseases that are related to glycocalyx.
Absolutely. What a fantastic tie-up. Thank you. Thank you, Bob, for all of that. And I really invite people to please go back and watch our previous show. Also, if you go to the drpbetteroff.com, hit the YouTube link, you can see all of these slides and all the information. Grab the QR code. And that will be on the website as well. But you can also slide down to the bottom on the YouTube channel and find your videos and channel, your YouTube videos and channel, where you can learn way more if you want to take a deeper nosedive into this. And I welcome it, and I wish people would share it too. Share the wealth of information. On the note of the glycocalyx, 7,000 square feet. That's a small IKEA. I mean, that is. That's a huge home for people. That's an amazing amount. And you're right. That should now be quoted in medical schools as the largest organ in the body. Gentlemen, you have been absolutely wonderful. Thank you for all this great information.
Thank you, Maryanne.
And all of your hard work and all the years of trying to get saving lives. I tell you, that's we'll sum it up that way: saving lives. Any final thoughts on anything you want to leave with the audience? A final thought?
Nope. Just be healthy, and hopefully this information we shared with you helps you improve your lifestyle and live longer and healthier.
Amen.
Same here. Thank you so much.
Absolutely. Thank you, guys. Everybody, drpbetterlife.com. Like, share, and gentlemen, thank you. We will see you again in the near future. Have a great week, everyone.
Thanks for listening to The Future of Vascular Health. Healthy vessels. Healthy future. Ready to uncover what's really going on beneath the surface of your health? Take our quick Revasca quiz today. Discover how well your glycocalyx, the crucial microscopic lining of your blood vessels, is functioning. Revasca isn't just another supplement. It's a scientifically backed solution designed to naturally strengthen your vascular health from the inside out. Say goodbye to persistent fatigue, brain fog, and circulation issues. Say hello to lasting energy, clear thinking, and vibrant health. Go to www.revascaquiz.com now to take the Revasca quiz and start your journey toward better health today. Because protecting your glycocalyx means protecting your future.